In this video, I'm going to share with you how I explain periodontal disease to my patients chairside. I usually do an illustration on a little sticky note that the patient takes with them. And I actually have had patients save those sticky notes. I had one client that saved the sticky note for almost a year and referenced back to it on a follow-up visit, and he said, "You've got to share this with more people." And he actually was one of the ones that recommended I started sharing videos such as this one so that other people can get this information delivered in a way that's easy to understand. I'm going to do a little illustration to help you understand what's going on with your teeth and where these pockets are coming from. So first we have your tooth, and it sits in a socket. Teeth are not actually connected directly to bone. They sit in a little socket. And then your gums are up here, up above the bone level. And this bone is porous. And what holds your tooth into place is connective tissue. So this is periodontal ligaments that connect and hold on to the tooth. And they go all the way around. And so what happens is when I take those little measurements, I'm taking a little ruler, inserting it under the gums and seeing at what level these ligaments attach. So I'm coming in here like this. This space right here is normally like 1 to 3 millimeters, and that's considered normal, and we're okay with that. So whenever I did those measurements, 1 to 3, that's normal. But what can happen is bacteria gets under the gums and causes infection in this connective tissue. And so instead of connecting up here at the crest of the bone, what's happening is it's connecting down here lower, leaving a space, a gap, that when I take that measurement, it sinks down deeper. And then also what's going on in that space is you're getting buildup and bacteria down under the gums that's deeper than your toothbrush bristles and floss can reach. Toothbrush bristles usually only reach about 1 to 2 millimeters under the gum line, and floss can typically reach about 3 to 4 millimeters. And that's if you're actually pushing the floss down deeper under the gums. And what we need to do with the deep cleaning is go under the gums. We'll get you numb for that, and we'll get all of that tartar out of there and reduce the bacteria levels. The body's amazing, and once we get those irritants out of the way, what can happen is your body will try to regenerate that connective tissue and close that space back up. And so this process here takes between 20 and 30 days. And so we're going to see you back in 1 month for a follow-up visit where we're going to take these measurements again and see where the progress is on this connective tissue. Something to note is if the infection is no longer just in this connective tissue and has actually moved into the bone level, instead of being up here, might be lower. So sometimes with the periodontal disease, and if we can see it on the x-rays, I point it out and say, hey, you know how we saw the bone loss on the x-rays? We know that it's not as high as it used to be. And so we're just hoping to get as much improvement as we can because that connective tissue needs a bone to anchor back into. And like I mentioned, this process takes between 20 and 30 days. So even after I do all my hard work, this is teamwork, and you're going to have to keep that space cleaned out until we see you for that follow-up. Other things you can do to help your body is to make sure you're taking a multivitamin. Like vitamin C is really important for connective tissues. And then if you're smoking or vaping, that reduces the blood flow in the mouth, and we need all of the healthy blood flow to help improve these tissues. So really try to cut back on that over this next month so that we get the most progress as we can from these services. I usually take that sticky note and attach it to their appointment card for that follow-up visit. That way I know that patient education has gone home with them, and they may take an opportunity to look at it again and just kind of reiterate what we talked about. And for my people that are still watching and that are super interested in more about this connective tissue, I'm going to give you a little bit more information. This is a step up from what I give typically chairside. Okay, so we have our tooth and the alveolar bone. Okay, we're going to name the different groups of principal periodontal ligaments just because, why not? So up here at the top, we have the alveolar crest group. So up here at the top, we have the alveolar crest group. Then we have the horizontal group. Then we have the oblique group. Then we have the apical group. Okay, then we have the intraradicular group going right in the furcation area. Okay, and these are attaching into the cementum of the tooth. And the average thickness of these ligaments is 0.2 millimeters. And just to conclude, I actually have had a patient hand me a perfectly healthy tooth that didn't have a single cavity on it because of periodontal disease. So taking care of this connective tissue, these periodontal ligaments, is so important. The good news is if it's less than 7 millimeters of attachment loss, we can usually see a turnaround with just non-surgical therapy, which is the deep cleaning. If it's deeper than that, then usually a periodontist needs to get involved to try to turn that around. Okay, 3 things to do every day: brush, floss, and pray.